Hello everyone. Now welcome you all into the part 2 of female sex hormones. Here we will discuss about the main hormone for the female sex hormones, that is estrogen. Estrogen, as you know, the body is producing the estrogen, and this produced or indigenously produced estrogen is utilized for almost every step of the reproductive cycle. And because of the estrogen, there are lot many important events are possible in the reproductive cycle. So these estrogen were which produced by the body, we call it as a natural estrogens, in which as you have seen before also, we have six type of estrogen, where estradiol is the one of the major one. So estradiol is the major estrogen secreted by the ovary. It is synthesized in a Graafian follicle, corpus luteum, and placenta from cholesterol. Estradiol is rapidly oxidized in liver to estrone, which is hydroxylated to form estriol. So you can see here this estradiol is converting into estriol as well as into estrone. Okay. Here another cycle is being shown where testosterone is lately converted into estradiol. Okay. So all three are found in blood, but estradiol is the most potent estrogen. Estrone is a metabolite of estradiol, which you can see here, that has approximately 1/3 the estrogenic potency of estradiol. Estrone is the primary circulating estrogen after menopause. This is again very important point. Estrone is the primary circulating estrogen after menopause, and it is generated mainly from conversion of androstenedione in peripheral tissues. Next is the estriol, which is another metabolite of estradiol, is significantly less potent than estradiol. It is present in significant amounts during pregnancy because it is the principal estrogen produced by the placenta. So we'll see these natural estrogens. The major estrogen produced by the women are estradiol, which you can write as an estradiol 17 beta E2, estrone, which we call it as E1, and estriol E3. Estradiol is the major secretory product of the ovary. Although some estrone is produced in the ovary, most estrone and estriol are formed in the liver from estradiol or in the principal peripheral tissues from androstenedione and other androgens. This all biosynthesis is very near to the cholesterol biosynthesis and the metabolism and the actions. And there, when you study about the lipids, you have to study about the liver role into this lipid. And here also, when you talk about the hormones, uh, you know, synthesized by the uh, lipids, then this point is very valid. Synthetic estrogens, a variety of chemical alterations have been applied to the natural estrogen. Means how we are getting synthetic estrogen? Just some alterations we are making on the natural estrogens. The most important effect of these alterations have been to increase their oral effectiveness. Why we need to modify the natural substance? Because we are giving it from outside. So giving it from outside means there will be some certain route by which you are giving. So it should be that route friendly, or it should be sustainable to that route. So to make it that, oral effectiveness, some modifications done. Estradiol, for example, ethinyl estradiol, mestrenol, tibolone. Non-steroidal. See, there are two: steroidal and non-steroidal. Non-steroidal is diethylstilbestrol, very much used product. Hexastrol and dinestrol. So, in addition of the steroidal estrogen, a variety of non-steroidal compounds with estrogenic activity have been synthesized and used clinically. These includes dinesterol, diethylstilbestrol, benzesterol, hexastrol, methastrol, methylenestril, and chlorotrianisine. These are some structures of these steroidal, synthetic, steroidal, natural, and non-steroidals. This is a classification of the drugs, not only the estrogen, all drugs which are affecting this estrogen system. So here estrogen and anti-estrogens are there, and there are drugs which are modifying the estrogen effect that are also here. So you can see estrogens. This is a first list of estrogens. Second is the selective estrogen modulator. Later you will understand about the study about the SERM, selective estrogen receptor modulators. So clomiphene, raloxifene, tamoxifen, tormifene are very important drugs. Progestins, these are the drugs called progestins. These are the forms of progestins. Antiprogestins, mifepristone and all. So like that, these are the drugs which used in this estrogen physiology. Regulation of secretion, this is very important to understand. Why? Because when you are giving a estrogen drug to somebody, already their body is producing the estrogen. So how much to give and how to give, this is very important. So the daily secretion of estrogen is in menstruating women varies from 1 gram to 100 gram, depending on the phase of the cycle. Secretion starts from the graphene follicle under the influence of FSH, and blood level rises gradually during the follicular phase. Already this point I have discussed in the reproductive cycle class. After ovulation, corpus luteum continues to secrete estrogen till about 2 days before menstruation. During pregnancy, placenta secretes large quantities of estrogen, reaching a peak of up to 30 mg per day at term. Their level declines sharply after delivery. So during the time of pregnancy, these estrogens are always there to protect and to perform several actions. In the post-menopausal women, daily production of estrogen have been estimated as 2 to 10, derived primarily by extraglandular aromatization of adrenal androgens. Now we'll see how this estrogen actually works. Estrogen bind to specific nuclear receptors in target cells. Now you remember the nuclear receptors mechanism, right? How the hormones bind with them, and then there will be the internalization of the receptors, and then they go to the nucleus. Means they go inside the nucleus, there they act on the responsive elements, right? The same thing is going to happen here as well. Estrogens bind to the specific nuclear receptors in target cells and produces effects of regulating protein synthesis. Estrogen receptors have been demonstrated in female sex organs, breast, pituitary, liver, bone, blood vessels, heart, CNS, and in certain hormone responsive breast carcinoma cells. The ER, now onwards we'll talk the estrogen receptor as ER, is an analog to other steroid receptors. Agonist binding to the ligand binding domain brings about receptor dimerization. I hope you remember this mechanism. the receptor dimerization, and interaction with the estrogen receptor elements of target genes. Two receptors designated as ER alpha and ER beta have been identified, cloned, and structurally characterized. Most tissues expresses both subtypes, but ER alpha predominates in uterus, vagina, breast, hypothalamus, and blood vessels, while ERB predominates in prostate gland of males and ovaries in females. Now we'll see what are the actions the estrogen performs. So you can say physiological actions or pharmacological actions. First action we'll see in perspective of sex organs and secondary characters. What the role of estrogen in this? Estrogen causes growth and development of the vagina, uterus, and fallopian tubes and contribute to breast enlargement. And it brings about the pubertal changes in these organs. Vaginal epithelium gets thickened, stratified, and conified. Estrogen along with progesterone are responsible for the proliferation of endometrium in the pre-ovulatory phase. You know that pre-ovulatory phase, the endometrium has to be thickened, right, and ready to hold the fetus. So the preparation has been done by estrogen. In the absence of progesterone, withdrawal of estrogen alone produces menstruation. They also contribute to molding the body contour. Uh, you know that the female body is different from the male body. A female body has different dimensions what the male body doesn't have. So, to give the shape to the female body according to the need of the female body, the estrogen plays a very important role in this. So, it molds the body contour, shaping the skeleton and causing the pubertal growth, spurt of the long bones and epiphyseal closure. Growth of axillary and pubic hair, pigmentation of the genital region, and the regional pigmentation of the nipples and areolae that occur after the first trimester of pregnancy are also estrogenic actions. So, now you can understand the detailing of the estrogenic actions, right? Even every where the estrogens actions are very much visible. Androgens may also play a secondary role in female sexual development. In boys, estrogen deficiency diminishes the pubertal growth spurt and delays skeletal maturation and epiphyseal closure. So, it's a female sex hormone. It doesn't mean it's not there in the male, and it is there in the males as well as it has a very important role. But the amount and the utility is comparatively different. So, it also plays a part in the skeletal maturation for boys. Estrogen deficiency in men leads to elevated gonadotropins, macroorchidism, and increased testosterone level, and also may affect carbohydrate and lipid metabolism and fertility in some individuals. So, you can understand there are very serious roles. Now, these very important effect of the estrogen or metabolic effects. So, many a time in the while I am talking about the estrogen in the classroom, I always mention a one word that this estrogen is a god for women. So, why it is god or not less than god? Estrogen, because what estrogen does for the women, actually the nature does to them, to that's why they are privileged, born with the protection. So, let us see what are the roles of estrogen in the as a metabolic effects. Many non-reproductive tissues including bone, vascular endothelium, liver, CNS, immune system, gastrointestinal tract, and heart expresses low level of both estrogen receptors, and the ratio of ER alpha to ER beta varies in cell specific manner. Many metabolic effects of estrogen results directly from receptor mediated events in affected organs. The effect of estrogens on skeletal aspects of mineral, lipid, carbohydrate and protein metabolism. So now you can see their roles are very diverse in the mineral, lipid, carbohydrate and protein metabolisms. Estrogens are anabolic, similar to but weaker than testosterone. Therefore, a small amount of androgen may be contributing to the pubertal growth part, even in female. Estrogen is important in maintaining bone mass, primarily by retarding bone resorption, by inhibiting the osteoclast pit formation. This is a very important role of estrogen. Sometimes we think that estrogen is used in the reproductive cycle, but here it is used. It's a it's a protective for women for the osteoporosis, because it retards the bone resorption. In the normal process, whenever there is a low calcium in body, so body needs the calcium for everything. So in that case, body want this calcium. In that case, body resorbs the bone and takes that calcium from the bone, because bone is a one big store of the calcium. So in that way, the bone gets weaker and get porous. In that way, the osteoporosis happens. So here estrogen is maintaining the bone mass. So first they are inhibiting the resorption, and second they means they elevate the bone formation processes as well. Osteoclast and osteoblast expresses both ER alpha and ER beta. The actions of ER alpha predominates in bone. So estrogen binds on the ER alpha, which is present in the bone, and then performs this action. There is increased expression of bone matrix proteins such as osteonectin, osteocalcin, collagen and alkaline phosphatase is also observed. It promotes positive calcium balance, partly by inducing renal hydroxylase enzyme, which generates active form of vitamin D3. Both osteoblast and osteoclast expresses estrogen receptors. Osteoblasts are those cells which are involved in bone building process, and osteoclasts are those cells which are doing the bone resorption process, means weakening the bone or taking the calcium off from the bone. So both these cells are having the estrogen receptor. It means this is a proof that estrogen acts on bone building process as well as they act on reduction of the osteoclast activity in the bone resorption. The major action of estrogen is to reduce maturation and activity of osteoclast by modifying regulatory cytokine signal from osteoblast. Again, a very important point of it. So it reduces the maturation and activity of osteoclast. How it does? By modifying the regulatory cytokine signals. The direct action on osteoclast is to accelerate their apoptosis. So it acts against of the osteoclast, but in favor of the osteoblasts. Pharmacological doses of estrogen can cause mild salt and water retention. Maybe some edema occurs in predisposed patients, but it can be treated with diuretics. This is a kind of side effect you can see. Blood pressure may rise after prolonged use. So because the edema, the water retention is happening, so but obvious that blood pressure will also rise little. Combination contraceptives containing higher doses of estrogens and progestins impair glucose tolerance. This is also people who are taking contraceptives have this kind of side effects where impaired glucose tolerance can be seen. Normal blood sugar is not affected, but diabetes may be precipitated. Or its control vitiated. However, amounts used for HRT is a hormone replacement therapy, and low dose contraception do not affect carbohydrate metabolism. So it means if the doses which are used for hormone replacement therapy and doses for contraception actually not affecting the carbohydrate metabolism. Estrogen decreases plasma LDL cholesterol while HDL and triglyceride levels are raised. Now, this is again very important point. That is the reason actually the women are quite protected from the heart diseases, because estrogen decreases the plasma LDL cholesterol and HDL cholesterol triglyceride level are raised. So you know very well the balance of these two. The raised HDL LDL ratio is probably responsible for rarity of atherosclerosis in premenopausal women. But at the same time, as you know, in the menopause, the level of estrogen is getting decreased. That's why the chances of bone related and cardiovascular related disorders are there. However, blood coagulability is increased due to induction of synthesis of clotting factors. So not only the bone, not only the heart, not only the cholesterol, but also in the coagulation it has a role. Fibrinolytic activity in plasma also tends to increase. Estrogen have been shown to induce nitric oxide synthase in vascular endothelium. The increased availability of nitric oxide could promote vasodilation. So you know that nitric oxide's role in the vasodilation. So these are the some pharmacological actions of estrogen. Now we'll see the in particular what are the adverse effects of estrogen. Suppression of libido, gynecomastia, and feminization when given to males. Fusion of epiphysis and reduction of adult stature when given to children. Stilbestrol given to pregnant women, especially during first trimester, increased the incidence of vaginal and cervical carcinoma in the female offspring in childhood or early adulthood. So stilbestrol, one of the most used drug, and also not means safety is a concern. Other genital abnormalities are possible in the female as well as male offspring. Estrogens are contraindicated during pregnancy. In postmenopausal women, estrogen can increase the risk of irregular bleeding and endometrial carcinoma. A progestin given concurrently blocks the risk. So, to overcome this problem, progestin can be added. Estrogens can accelerate the growth of existing breast cancer, but low dose estrogen, only hormone replacement therapy doses, not appear to increase the risk of developing new breast cancer. Long-term estrogen therapy doubles the incidence of gallstones. So another problem, the estrogen used for long-term, the gallstone is the one can happen. Benign hepatoma are more common in women taking estrogens in their teens and 20s. Migraine, epilepsy, and endometriosis may be worsened by the estrogen. So these are some mediators. Now we'll see the physiological and pharmacological uses of estrogen. First use of estrogen is in hormone replacement therapy. Due to cessation of ovarian function at menopause, women suffer a number of physical, psychological, and emotional consequences. And by this, many problems can be generated. Vasomotor disturbances, hot flushes, chill sensations, inappropriate sweating, faintness, paresthesias, aches, and pains. These all are happening due to menopause. So to rectify this, to correct these problems, there should be some amount of estrogen be given, and that can overcome this. That's why it's called as the hormone replacement therapy. Urogenital atrophy, changes in vaginal cytology and pH, vaginal dryness, vulval shrinkage, dyspareunia, vaginitis, itching, urinary urgency, predisposition to urinary tract infection, etc. So one role, you see the very important function in the hormone replacement therapy. Now the another one in osteoporosis. Osteoporosis is what happens here. I already discussed about it. The loss of osteoid as well as calcium thinning and weakness of bone, minimal trauma, fractures, especially of femur, hip, radius vertebrae, dermatological changes, thinning and drying, and loss of elasticity of skin, wrinkles, thin and listless hairs. Psychological cognitive disturbances, irritability, depressed mood, loss of libido and self-confidence, anxiety and dementia. These all are the part of the menopause. So in all these conditions, the hormone replacement therapy can be done, or the estrogen can be given on various modes. Increased risk of cardiovascular disease, coronary artery disease, myocardial infarction and stroke. If there is any case where they found that there is an increased risk on cardiovascular diseases, coronary artery diseases, myocardial infarction, stroke, the hormone replacement therapy can be given, or the doses can be given. The dose of estrogen used in HRT is substantially lower than that for contraception. So these are the doses used for this purpose. It's also used in senile vaginitis, used for delayed puberty, and used for dysmenorrhea. It's used for acne. It occurs at puberty due to increased estrogen secretion in both boys and girls. Estrogen benefits by suppressing ovarian production of androgen by inhibiting gene release from pituitary. In girls, topical therapy with antimicrobials tretinoin and other drugs is preferred. Dysfunctional uterine bleeding or progestin given cyclically is the rational and effective therapy. Estrogen have adjuvant value. Also used in the carcinoma prostate, estrogen are palliative. Phosphestol is preferred by some as it is concentrated in the prostate where it may antagonize androgen. High dose are needed. GnRH agonist with or without androgen antagonist are preferred. So these are the uses of estrogen. So I hope you understood the mechanism of action, pharmacological and physiological actions, ADR, and the uses of the estrogen. In the next class, I have to discuss about the drugs, supportive drugs, either as a modulator of estrogen or to inhibitor of the estrogen. These are the references used. Thank you for listening this video, and please wait for the part 3 where the other drugs can be discussed. Thank you.